So today we're going to be talking about ARBs, angiotensin receptor blockers. I've discussed RAS and ACE inhibitors in the previous videos, so check them out. ARBs act by blocking angiotensin II action at the receptor level rather than by inhibiting its synthesis. So it acts similar to ACE inhibitors, but rather it blocks AT1 receptor. AT1 and AT2 are the two receptors of angiotensin II. So this AT1 receptor has functions of vasoconstriction and such. And this ARBs acts by blocking AT1 receptor. This leads to increasing levels of angiotensin II here. So normally in RAS, when BP decreases, renin acts on angiotensinogen to form angiotensin 1. And this angiotensin 1 is in turn converted to angiotensin 2 by the action of angiotensin converting enzyme or ACE. So now angiotensin 2 can act on two receptors, AT1 receptor and AT2 receptor. We're not going to discuss AT2 receptor in this video, only AT1 receptor since it causes vasoconstriction. And it also triggers aldosterone release from the adrenal cortex. So blocking of this receptor obviously leads to the decreasing of BP. If we take this as the AT1 receptor, these are the angiotensin II, and normally these will bind to the AT1 receptor to produce vasoconstriction. But in this case, when we administer an ARB, this receptor, AT1 receptor, is blocked and there is no action of vasoconstriction. Instead of that, we get vasodilation. So ARB blocks the action of AT1 receptor and produces the opposite action of what it normally does. This causes vasodilation and excretion of sodium and water, which in turn decreases the blood volume. Since the ACE is active, it breaks down bradykinin, so dry cough is not commonly seen, as opposed to ACE inhibitors in which we have persistent dry cough. Because in that case, ACE is inhibited and hence increase in levels of bradykinin leads to persistent dry cough. All of the ARBs end with sartan, example losartan, valsartan, candesartan. The side effects of angiotensin receptor blockers are hypotension, hyperkalemia, angioedema in case of fever, headache, dizziness, etc. The uses of ARBs are for the treatment of hypertension. ARBs does not induce cough and has a lower chance of angioedema, rashes, etc. So it is definitely a better treatment for patients who cannot tolerate the dry cough and such. Next, in the case of congestive heart failure, it provides symptomatic relief. In myocardial infarction, generally ACE inhibitors are first used. In diabetic nephropathy, renoprotective